Welcome back to the Pediatric Practice Management Awesome Cast. I'm here with Brandon. We're on our 26th episode, a little bit more than a quarter of a century here. We're excited to finally get back into the studio, as it were, because it's been a while. Say hello, Brandon.
Hey everybody, how's it going? Hey Chip, how's it going?
It's going well, thank you. We are here to talk. Brandon and I always try to brainstorm our topics beforehand. You wouldn't know based on how disorganized we sound usually when we're on this podcast, but we wanted to talk about a subject that came up on the SOAPM list quite a bit the last week or two that Brandon and I both feel pretty passionate about, and that's the newfound competition that independent pediatric practices have with RBCs, retail-based clinics, or our other friends, the after-hours clinics or the immediate care centers. And basically, I lump them all together, even though they all have different flavors. I lump them all together as people who are getting in between you and your patients clinically. And so I know that Brandon's been doing some research about it in his practice that, to support his position or maybe to learn more about his position, and I know he wants to share it with us. So I'm going to start with you, Brandon, and I'm going to ask, what do independent pediatricians need to think about or need to feel about retail-based clinics?
I think that there's a lot of questions. Usually when I get asked things like that, the first thing that comes to mind is to ask more questions. Because of course we all know that we all are in different environments, different markets. Some of us have a lot more pressure from these institutions than others. For example, in my area, we really, we do have a few retail-based clinics, but it isn't, as crazy as it is in other areas. So it's not like we don't have a presence here. And we do get our letters from time to time from retail-based clinics of patients. And one of the first things that we do, or I do, when I get one of those, is I always want to see what time, what date and what time. And
Exactly.
I always hope right before I open the letter is that it was a Sunday afternoon or something like that.
Right.
And the sad thing is that it's not always a Sunday afternoon. It's like a Tuesday at 3 o'clock, and I'm like, what is going on here? And I'll jump to that date for the schedule sometimes, and just to see like what were we that full? What's going on? And when I inquire, and hopefully not too many days have gone by, because when I ask somebody, it's like, I don't know. Nobody knows anything when I ask my front desk people. But sometimes, I'll look at the schedule and see, well, perhaps the mom wanted something at 3 o'clock precisely, and we didn't have it, and they didn't want to wait until 4:30, or whatever the case might be. So
Even though they may have waited until 4:30 at the retail-based clinic, but that's another story.
Yeah, exactly. But that's part of the understanding to me. Understanding that the problem is understanding why people go there in the first place. And then if you are part of SOAPM and you did read all that, and for those of you that don't know what we're talking about, SOAPM is a listserv from the AAP. It's called we call it SOAPM, Section on Administration and Practice Management. I know, Chip, that we have a lot of people that aren't part of the AAP community that don't know these things. But anyways, that's why I bring it up. And we have lively discussions about things. And so one of the things that there was a lot of going back and forth. What would you say, Chip, would be like the number one complaint that the doctors had when they were addressing the RBC? Because the title of the subject was, I think it was pediatricians have a marketing problem, which I absolutely agree with. But what would you say would be the top kind of complaint that the doctors had on that discussion?
Well, I think they are frustrated that their patients go to these RBCs, particularly during hours that the office itself was open. I think we all recognize that if it's 9 p.m. on a Friday night and someone knows that they don't need to go to the ER, there's nothing on fire or bleeding or broken, but at the same time they have a sore throat or they're worried about, their kid throwing up. It's one thing when you visit, these clinics when the practice isn't open, but to do it, as you pointed out, at on a Tuesday at 3 o'clock, that becomes very painful. And a lot of physicians very rightfully first of all, feel like that you just took a visit right out of their pocket.
Yeah.
And I also think they're frustrated because they don't quite understand, why would somebody go to a place with clearly lower clinical standards, because many of these places are not even staffed by physicians,
Yeah.
and to a resource that has no understanding of pediatric patients or this family in general. Why would you go somewhere that you haven't been going for 15 years? Who knows your family? Why would you avoid that? You know, and is that really worth the $10 copay savings, or maybe? I think that's the #1 complaint. And the title of the email that spurred it all, that pediatricians have a marketing problem, I think was exactly right. And part of that marketing problem is that the pediatricians don't always understand or adapt to their own market. That's part of the problem.
Well, so I absolutely agree, and I would summarize that by saying that probably for me, when I read it, is the quality of care. So they were angry that that patients were choosing what they consider was less than, for lack of without being a little bit more PC, trying to be PC.
But we don't have to be PC about it, though. The fact of the matter is, we know, without even trying, so many horror stories about the quality of the care that people get from these RBCs. It's horrifying. You know, you walk in there with a sore throat, and you walk out of there with Zithromax for an undiagnosed, for strep throat that doesn't exist.
Yeah.
And it's how some of the behavior that we've seen in these clinics is legal or protected. I don't know what to call it. Is beyond me. So no need to be PC.
All right. So the quality of care is less than what we would hope for it to be, I guess, for our patients in particular.
Yep.
So I started thinking about this, and I just happened to stumble upon an article this couple of weeks ago, or maybe a week ago, and it says three trends driving retail health clinic expansion. This I'm trying to find Fierce Health. This is an article from Fierce Health. It looks like it was published in April 7th of this year, 2014. So it had #1, doctor shortages. It had #3, clinics are ahead of the curve on price transparency. So they're saying that these retail-based clinics are a lot more forthcoming when it comes to pricing as opposed to doctors. That's #3. But the #2 was quality care at lower prices. And the article referenced a study that was done in 2009 that they said that the most common conditions for the retail-based clinics was pharyngitis, urinary tract infections, and middle ear inflammations. And they said that on average per patient encounters was less than certainly an urgent care center, and then less than what a doctor's office would be, and then of course the ER was crazy, right? So they said basically, that's the reason. So what I did was I wanted to find out what was our top diagnosis, and what I didn't want to find is that our top 3 diagnoses were those 3 things, because I found it to be a problem. Because at the end of the day, in my view, I think that the retail-based clinics do have an edge on us when it comes to convenience, when it comes to access, and the fact that the pharmacy is right there, and then you can walk out with a pack of cigarettes and a gallon of milk. Although now, the cigarettes is not a deal. But anyways, the point is that you can walk out with chips. I don't know, chips and some milk.
Everyone wants to walk out with chips.
Yeah. So anyways, let me see if I can show you the screen, Chip, of what I did. And let me jump over here and share my screen real quick. All right, can you see what I have there?
All right, and what I want everyone who's watching to do, we'll post this. We'll post an image of this on the website. But everyone who's actually watching this as a video, as soon as Brandon starts talking again next, hit pause. You can make your own screenshot if you want to, and you'll be able to see what he's doing if I happen to talk. So anyway, go ahead, Brandon.
Okay. So what I did is I ran all our top diagnoses since the beginning of time, since the beginning of our existence for the most part, and just to see what were our top diagnoses. And I did a little bit of consolidation in terms of, you know, for the wellness exam. You know, I instead of separating them by age and stuff like that, I just kind of put all the wellness together. And then this only shows the top, what is it, like top few diagnoses. Of course, you know, there's a whole bunch of them. But then what I found at the top of the list was fever. Okay, then after that is otitis media, cough. Here's a urine, probably a acute urine something is the description that it has. Sore throat, pharyngitis, which is also on the list that I just mentioned from the article. Acute bronchospasm, bronchiolitis, throat pain, and allergic rhinitis. So in my graph on the right-hand side of at least my right-hand side of my screen, obviously it shows that I have a whole bunch of wellness visits. Remember, those are several years worth of diagnosis. And then I added up all the common sick, so the ones starting from fever all the way to allergic rhinitis, and then that's the number that's right next to it. But the reason why normally you would have a lot more sick than well, the reason why that doesn't appear on this screen is because I'm not taking into account all my sick visits. I'm only taking my probably top, what is that, like top 10 sick visits. So Chip, the reason why I did this, and let me go back to the screen. Which I can't figure out, but anyways, let me go back here. Okay, I think I got it. So the reason why I started doing this is to get an idea on what it is people were going to the retail-based clinic. It's getting kind of crazy, huh? Here on the screen.
Brandon, that was pretty awesome. Whatever you just did, I don't know, but
I did it again. I can't get my for those of you that are listening, I apologize, but our screen here is going crazy when it comes to.
Just you know what I'll do, Brandon, is just keep talking. I'll take care of it.
All right, I think I'm back. Can you see me?
Okay, there you go.
All right. Is to try to get a handle on this, right? So my question is that if we have overlapping diagnoses and the patients don't have a very good understanding of the difference between getting care at a retail-based clinics and what it is of coming here, then how do we address that issue? Essentially, that's what I was getting at with the data that I was pulling. And clearly, the data shows, at least from my perspective and from our practice, that there is a lot of overlap in what they treat and what we treat. Now, granted, the study didn't make the distinction on whether or not those were children or not, but I think that we can make some correlations that are in terms of what we should do in order to kind of not combat this, but to address it. Any thoughts so far on what I pulled up?
Yeah, I just want to show you one thing. I did some similar work myself on my blog back in January as we were looking at some ICD-10 work, and I also did it in 2010. So if you go to my blog, you'll be able to see this. Hold on, I'm going to share my screen myself. Whoops, wrong button. Right here. And we're going to do here. And can you see my screen share right now? What we have here are the top ICD-9 codes. If you just go to chipsblog.pcc.com and just look up ICD-9, you'll find it pretty easily. And Brandon, what I saw is, here, I'll jump to the top. I just made a quick table. The routine child health exam, known as the V20.2 or the well visit, is clearly the most popular single diagnosis. But once you remove the most common diagnoses, the common preventive diagnoses, you quickly see. I ended up with a diagnosis list that looked a lot like yours and a lot like the report that you read. Pharyngitis at the top, URI, otitis media, viral infections, strep, sore throat, otitis media, rhinitis, fever, cough. These are all the things that, these are all the breaks in your schedule that keep your schedule full. They represent about 2/3 of your visits, but the variation among them is pretty broad as you start looking at things. But so back to you, Brandon. I just want you to show some more data.
Yeah, I think it's cool that two different kind of sets of data have kind of very similar results in terms of what the top diagnoses are. Now, to me, that's a concern because the retail-based clinics and some of the other ones, however you want to catalog them, they're not going to go away. And the truth is that there is a shortage of doctors. So, for the adult people, the adult crowd, I think that this is a viable solution to forego quality of care for access, because if you have to wait 3-4 weeks to go see your internal medicine doctor and and you're sick, you can't wait. Now for pediatricians, I think it's a little bit different. Now here's what I did. I started thinking, well, have we done a proper job of telling people about our open access schedule? And the fact of the matter is that I don't ever recall ever making it a point to mention that. So what did I do?
That's a big deal.
Exactly. So here's why people go at at 3 o'clock in the afternoon on a Tuesday to the retail-based clinic instead of us. So as an experiment, and this is one of the great values of social media, and this is another reason I keep on beating this drum. But so we have roughly 2,000, I don't know, 2,500 or something like that, people that follow us. I'm guessing not all of them are patients, but who cares?
Yep.
Well, I went out there and I said, hey, did you guys know that we have open access scheduling? And this is what open access means. It means that if you call the same day, 99.9% of the time, we are going to see you. We strategically block out certain times of the day so that when you call us early in the morning, we will see you. And then I also explain that even if you get a call from the daycare or school in the midday, then we have appointments dedicated for those situations. And so, like I said, 99.9% of the times, we will be able to see you same day. Chip, you would not imagine how many responses we've got from that. I wish I had the screenshot of that. Nobody wrote down, I didn't know that. However, all the moms were like, I love this about you guys. It said, you guys have saved me, from work before because of this. This is one of the things that makes you guys so special. I mean, I'm not making this up. These are all the responses that we got just based on that post. And of course, as we all know how social media works, those comments shows up on other people's profile and other people's thing, with their friends, and kind of how the social network
best advertising in the world.
It's the best advertising in the world. And
how much, when you put it on Facebook, did you promote it?
I didn't promote it because I was just like, hey, this is just a status update.
Yeah, you should.
Guess what I'm going to do now?
Yeah, I want you to spend $30.
Out of that,
I want you to tell me how it works.
I will. So what I wanted to do is create something like, because they say that when you have a posting that has a picture, it usually does a little bit better, and I'm very good with pictures and words. So I wanted to create something like open access, this is what it means, do it again, and then be able to promote it so it comes up prettier in people's feeds. But so that's what I'm talking about.
Second, you won't be able to promote that because if you post, just so you know, an image with words in it, Facebook disallows.
Okay, that's true because I've gotten that's gotten back, but at least a picture of a little kid or something like that. What I'm saying is that it needs to have, people are more attracted to that than they would otherwise. So yeah, you're right about that. But anyways, the point is that I'm going to promote the heck out of that because, so that was the question that I had, like when parents were saying when the doctors were saying, I just can't believe they don't, understand this. And my question was, well, what have you done to explain this to parents? And when I asked myself that question, the answer was zero. Right. We have not done anything. Yeah, the hours are on our website, but it's not in the hours maybe are in our handbook or our little welcome package, but it doesn't emphasize like this is a big deal. We're open. I know some practices on SOAPM, I mean, they're open 7 days a week, right? And they're open on Sundays and everything. I mean, we work on Saturdays, and we don't like to advertise that too much because, it's only from 9 to 1. But I know that some people have full hours. So the question is, have you, promoted that from your practice? The other thing is that here's with the social media. One of the things that I wanted to do, and I never have the time, but I hear Joanna, my wife. For those of you that don't know, my wife is a pediatrician. We work here in the office, et cetera, et cetera. So I sit next to her now, and this isn't new to me because when we first opened the practice, it was just her and I, and we drove together, and I could hear her answering all the questions, that parents called, and so that's very common. And I've always wanted just to film her explaining why is it that we don't prescribe, antibiotics over the phone, right? She gives that explanation I don't know how many times a day. So in terms of quality of care, those are the little things that we could do, I think, that are not very expensive. Social media gives us a platform to do it, and we can little by little start making these little, carving our little niche out that separate us from, these, and that's why I came up with the description between, like, you have the Walmarts of the world, and then you have the Nordstroms. Walmart obviously is going for, dirt cheap, easy access, all those other stuff, and Nordstrom's, it's not that I'm saying that we should charge Nordstrom prices, but there is a distinction that it isn't the same thing. You receive a lot better quality, or in their case, merchandise, but when it comes to us, it's quality care. So therefore, we should be able to make that distinction. And I'll give you an example, Chip, here. Well, I don't know if you wanted to add something to what I just said. Let you jump in.
No, one thing
you're yawning too much, Chip. You're yawning too much. That means that's concerning, because that means that potentially our audience is yawning as well.
No, I'm not yawning.
That's a bad sign.
My ears are plugged down here in our basement. That's what happens.
It just occurred to me that you can put two ferns next to you, and you can call between two ferns, and we can just not call. You're like Stalagnopithecus or whatever that guy is.
That Galifianakis. I can't say it because you didn't say it right. Unfortunately, the comparison between me and Zach Galifianakis has been made more than once. They say I've had people tell me.
Because of your appearance, I'm saying that on how bored you look right now as I'm talking, the way that
I sound like somebody. I'm not bored. Here's one thing I'll tell you. Number one, you have an iPhone, a smartphone, or whatever. The next time your wife goes to give that talk, hit record, right? Not even the video, and then write it down, and you should put that at the top of your Facebook and stuff. But here's why I'm giving you grief. But she makes the appropriate clinical decision to not dispense antibiotics inappropriately. And when the RBCs of the world give the patients what they think they want as opposed to what they need, they are actually doing your patients a disservice. And what your wife, what you need to incorporate in your office, and when your wife says, I'm not going to give you this antibiotic because it's not good for you, unless you come in and I confirm it, I am more worried that you will get an antibiotic inappropriately than I am worried that you might not get an antibiotic appropriately. And you need to teach that lesson to your patients over and over and over again. That thing that you think is more convenient, to be able to just call and get drugs, is actually less convenient for you in the long run. And since that difference exists, since you are not going to just throw pills at people, and the RBCs will, I'm a fan of owning that. Don't pretend that's not true. Instead, embrace it. Say, and the reason you're talking to me is because I went to medical school. I'm a doctor, not just a nurse, and I know, based on all these things that I learned, all this training that I had, all these tests that I took, my residency, my experience as a physician tells me that you are better off not getting this drug over the phone. But if and that's why I have this stance. That's sort of like your value proposition.
Right. The problem is, though, is that we're not, and this is what's the problem, what the essence of the problem is, that, like, that conversation that you just said happens all day, every day in the clinics, but in the exam rooms. They don't say it just like that, but, they are kind of giving you advice and giving, all this other things. The problem is that the public at large, doesn't, view it like that. So I mean, even if here's another topic of discussion that that probably for another podcast is this physician rating sites, right? If you ask them, I mean, if you look at that, there's nothing there about quality of service. There's like, is parking convenient? Did I get an appointment in time? Was the space clean? I mean, those were the questions that they're asking.
Let's save that one because I have some stuff to say. I know you have stuff to say about that. I do too, and we'll waste another hour talking. So let's go back.
Yeah,
right,
but
so
my point is that we are not measured by quality of care. We are measured by convenience. So when you say embrace that, I absolutely agree with it. But then there has to be some sort of leverage because on our own, one patient at a time is not going to be enough when you have the retail-based clinic opening 800-900 stores a year. Here's
why I don't worry about it, and I know you agree with me on this. I think you can do it one patient at a time because you're going to see 6,000 of them this year. I'm going to ask you, and I know, Brandon, of all the people I could call, I know how you feel about this stuff, all right? So I'm going to ask you some questions, and I realize I'm putting you on the spot, but I know that you'll appreciate it. So do you have written anywhere on your website or in patient handouts or on the wall in the exam room or in the waiting room a little, 5-sentence piece why we don't dispense or why we don't prescribe antibiotics over the phone? I mean, you probably don't. I've never seen it. So what if, and I'm using just this as an example, it could be any one of 30 other subjects, what if every single time somebody came in to your office for a well visit over the next 6 months or a year, one of the things that you handed to them or one of the things that you emailed to them or one of the things that you put on your portal is, Dr. Betancourt's reason for not prescribing antibiotics over the phone, and she is able to say that, look, since my career has started, the New England Journal of Medicine, the National Institute for Health, CDC, here are 5 references that are easily read, easily pointed out. Here's a USA Today article about the overprescribing of antibiotics. Here is another article explaining how when you get an antibiotic for a virus, your physician is not your physician, I hope, but your nurse practitioner or your medical assistant is actually harming you. All right, and why not fully get that message out? If you did that every day for 6 months, you'd have 3,000 people in your community.
Well, here's what I said. Here's what I mean when we can't do it alone. What you're describing is reinforcing the message. So the doctor's going to have that conversation. So what I'm suggesting is that don't limit it to just the conversation that the doctor's going to have, because they are going to have that. So that way is not going to be enough. That's what I'm suggesting. So what you described about having something on the wall in each exam room, just a really quick, 3 little bullet points or whatever you want to do it. Okay, that's one reinforcement. The doctor's going to talk about it. Then she's going to talk about it maybe again on the phone. Then in our handouts, or because we don't have a handout, by the way, that that talks about that. So perhaps we can put it on the handout on our webpage, and then we can talk about it on our Facebook, Twitter, blah 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 blah, everything else. So then now, little by little, we start granting and that's what I mean about that. It's not enough.
Just fully 100% agree. That's what I want to see done. And because of the pediatric groups you're in, whether it's SOAPM or it's some of the pediatric Facebook sites and so on, you do it right once, or you see someone else do it right, you just take their material and you just spread it around. And that's the SOAPM way, yeah. Yeah, if enough of your peers are saying the same thing, then stuff starts to stick. And I know you love creating posters, okay?
I do.
And you could create an antibiotic poster that could be 2 feet wide and 3 feet tall that sits in your exam room, and then you could share that. I would blog that one in a second.
One thing that I'm doing, this top diagnosis code that I was doing, there was another motive that I was doing it for as well. What I wanted to do is create an infograph. I don't know if you guys have seen those online. They're kind of really cool ways to show a whole bunch of data. So what I wanted to do was, and in fact I might still do it, is grab that data and just say, create a nice big poster of sorts and put it on our blog and everything else, on just how awesome the pediatric office is in terms of here's how many kids we've vaccinated, and then translate that into money on like how much would it cost somebody to get that disease. So you can, you know, put some money attached to it, and that's just an example. I'm not saying that I'm going to do that, but you know, like here in that thing that I posted, we have here, you know, seasonal. Since I ran the report, 21,939 flu vaccines that we've given out since we opened the practice. And you know, what are the consequences of that in terms of community health care and all this other stuff? Let me see what you're very, you know.
I would love to see that. I've been advocating that kind of concept for years, and everyone's too chicken. What I want to see you say is, since 2010, Dr. Betancourt has done 5,000 vision screenings. During that time, she has diagnosed 300 of these, 200 of these, 15 of these, 27 of these. Do you want your child to be one of those kids?
Yeah, exactly. So with the infomercial, you have the data, and then you put context to it, like what you're describing right there. I think that's just one of the other ways that you can, you know, really start. And you can have that thing, you know, those infographs are really long. If you see one on the web, you have to like scroll and scroll and scroll. So you can create a really cool top-to-down poster and just put that thing downstairs, or well, in my case downstairs, or put that thing outside in the waiting area. And you know, and like you always say, Chip, put some scary stuff on there in terms of some nasty diseases and stuff that could really get ugly, just to scare people just enough, you know.
No, yeah, because I can see a skull and crossbones on your infograph now.
Yeah, well, you know, the funny thing is, well, it's actually not funny, but if you see, you know, like a Red Cross or any of these institutions, I mean, they're pretty graphic. I mean, they'll show a kid, a poor kid, with like their leg amputated, you know, sitting there, and just says, you know, for $1 a day, this kid can go to school or whatever the case. I mean, that essentially is an infomercial that really gets the message across.
Retail-based clinics, like, you know, like the ones at Walgreens, or the ones that we're hearing that you know, about it, we're gonna get from Walmart. They employ professional marketing companies to direct messages at these patients to capture them. And what does a typical pediatric practice do for generating messaging to patients? Nothing. Well, I'll just put up one. That's infinity. Nothing. Zero. And how can you compete with that? It has, you guys, as a pediatric practice, it's like the easiest thing in the world to sell. You have something that no one else can provide. You have something that's essential to everyone's health. Yeah, and pediatricians have been getting away without doing anything for marketing.
It wasn't necessary, and that's my point. Like up until now, it wasn't a big deal, but now, you know, it is. I want to show you. You said that we have done 0. I have a little pretty picture with a little. It's going to take me a little while. Maybe I'll find in just a second. That it's a kid with like blowing his nose, and it says same-day appointment for when you just can't wait, or something like that. And that's the postcard that, you know, sometimes I send out to. One of the things that we do is welcome wagon. So anybody that moved into the area, we introduce ourselves, and that's one of the ways that I do it, just to let them know, hey, give us a call today, and we'll see you today. So, with exception of us, Chip, they have done. Everybody else has done 0. Chip, I want to tell you a little cool story. This is kind of related, kind of not related, but it's a great customer service story, and I love customer service stories. And I'm always looking for ways to steal on how other people do it, and kind of what emotions that it stirred in me, so then I can perhaps use it somewhere else. So we buy our business card from a company called moo.com, M-O-O.com. Go there and visit it. They're kind of like really cool design business cards. They're not your traditional business cards. They're made out of different materials. It's not your Vistaprint type. Now you pay a little bit more, but they're awesome. They're cool, and I do all kinds of stuff. Like again, trying to be unique, trying to be a little bit different. Like I'll put parenting quotes. Like on the front, you know, I'll have our information, but in the back, you know, I'll find a whole bunch of quote by like what's this guy's name? Really funny comedian. The Jello.
Bill Cosby.
Bill Cosby. You know, he'll have some funny parenting quotes, and he'll say like, you know, parents aren't interested in fairness; they're just interested in quietness, or something like that. So, or like everybody knows how to raise a child, except those that have them. those sort of thing, you know. Or I'll put, you know, my pictures and stuff. But anyways, okay, so they're really cool. They're a little bit more expensive, and we also use them to send out to the OBs. Here's a little another side story. I just can't help it. So I send out Joanna and I prepared a whole bunch of them, and Joanna made it really pretty, and then we rolled them up and wrote a nice little letter, and I send them to all the OBs like, you know, thank you so much, you know, for your support and all this other stuff. And by the way, you know, we're here to serve, da 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 da. And we send everything out. It was really pretty with our really pretty business cards. So we sent it, I don't know, we sent about 10 to 10 offices. Without exaggeration, Chip, I got 3 calls back, not asking us about our practice or anything, but they wanted to know where we bought our business cards. And I'm like, well, if you send me a patient over, I'll tell you where I got it.
You send me some more pictures, I'll make them for you, you bozo.
I know, can you believe that? But anyways, those are how cool they are.
I can't believe it, but that's too bad.
Anyways, so I get this regular box mail thing, right? Now, it's written by hand.
Yep.
Right? If you've been to any of my talks, particularly my collection talks, when we send out letters for collection, we handwrite every single one of them. It just gives, and I have a long story for why we do that, but essentially it gives a personal touch, and that's really to get their guard down. So people's like, oh, I got a letter from somebody. What is this? And damn it, it's a collection letter. So, so that's one thing. Okay, so I open it up, and then I get an envelope also with my name written.
Yep.
Handwritten. And then I get this letter. Now, the letter is from the CEO of the company, all right? And basically what the letter says is, you know, thank you very much for your business. You know, we love it. We have a new, that you're part of it. You're one of our top, you know, people. I don't know if that's true or not. But then he says, you know, the paper that you are holding is actually a new product that we are releasing. So they're starting to do letterhead now with cool design. So here's the letter in the front, and look, Chip, in the back it's got like these groovy colors and stuff like that. The guy telling me, what was that?
On the computer it looks kind of funny.
All right.
It looks great though. It's cool.
The guy starts telling me that they didn't just pick this piece of paper just out of nowhere. I mean, like the texture, the weight, how it folded. The guy explains all these things. So this, like, it's not a coincidence. So I thought that was really cool, because here's a great way to, you know, to promote something. Tell me a story, make me feel special, and do it in a really nice, classy way. But here's the awesome thing about it. So the guy sends me this book, all right? It's a pretty big book, all right? It weighs a lot of money. So they paid, it doesn't say, they paid $13, $13.90 to send me this book, plus the cost of this book. So what's this? It's letters of note. So the book is essentially handwritten. You can't see it on the screen, but they're handwritten, some typewritten letters from famous people to other famous people, which I thought was really, really cool. And here, let me see if I can explain it. That the guy says, okay, here it says, finally, to inspire your next letter, I have included a copy of Sean Usher's book, Letters of Note, which is a collection of some of the most amazing letters ever written, curated from his blog of the same name. It's one of my favorite, and I hope you enjoy it.
It's on, just so you know, it's on Amazon, and the hardcover copy is not cheap. I just looked it up.
And this is a hardcover copy. But here's this. I haven't gone through it entirely, but you know, the Queen of England sending Eisenhower a note saying, "Hey, I noticed on the in the newspaper you were barbecuing. I forgot to give you my barbecuing recipe," and she actually includes it and sends it to I think it was Eisenhower or somebody like that. Don't quote me about that. Yep. But anyway, it was from the Queen of England to, you know, a president of the United States. So, and it's got these handwritten letters, you know, from Elvis Presley and some other things, which is really cool. But why do I bring this up? This is the sort of thing that I like to think about on how we can create that special environment, that we are not just simply a place where people come in, that patients are not simply a number. And granted, that's very expensive, and I'm not going to, and perhaps you would want to give a book to new parents, and if that's in your budget, I think that's a great way of doing it. But there's also, you don't have to be that expensive. I mean, we all know of a mom and pop owned diner, right, that we love to go. The food isn't all that great, but we love to go there, right? It's a tradition. The people make us feel they know our name. And yeah, the food might be good or the food might be okay, but we love going there for certainly not the food, or maybe, but for the environment, for how we feel and what we get that. And that's another kind of the things that I think that it's important for us to understand in terms of separating ourselves or distinguishing ourselves with these places, because in my view, the status quo is not scalable. We are not going to be able to compete with them with their rules, I guess. And so so yeah, I mean, I guess that's what I want to add.
All right. Well, thanks for sharing that book. It actually looks really cool, and it was impressive that this guy sent you all that material.
Just to introduce a product to me.
Yep. So going to your last point, I mean, I think I can summarize it in a sort of, I hope, in a conclusive way. You're not going to be able to out Walgreens.
Yeah.
It's a different. You're not selling or providing the same service. You're not. And to pretend you are is a mistake. One of the things that I try to get pediatricians to understand is that if you build your business on those cheap little pieces of being a pediatrician, those easy otitises and the 100-degree fevers and the green snots, you are, you should be threatened by the Walgreens of the world, because there's very little magic there a pediatrician can perform. You're not really going to change someone's life or delve into something developmental when you're dealing with a 100-degree fever. There's nothing a pediatrician has ever been able to do. You can't cure a cold. But what you can do is teach your families how to grow and how to develop healthily. You can spot developmental issues, whether it's behavioral or skeletal. I mean, it doesn't matter what the developmental issue is. All that screening that you do that the retail clinics can never do. That's your value, and that's what you need to hold on to and promote. The
promoting part is the big, and that's kind of like my point, anyways. Is like it needs to be promoted.
And it's time to get offended by some of the clinical decision making. I can't be offended by a parent looking for care at 9 o'clock in the evening and going to a retail clinic if one's open, or an immediate healthcare center. I can't be if the pediatric practice isn't open. But I can be offended by or bothered immensely by a family getting a quote-unquote sports physical by the team doctor, in 3 minutes or less, that's supposed to substitute for a full well visit at the pediatric practice. And pediatricians need to start putting their feet down and making it clear, this is why we exist. We are here to do this service which nobody else can do. And I'll just add two things. One of the things I've seen a lot of while doing consulting the last couple of years, and these practices who come to me and say, our visits are down and our money is down and we don't know what's going on, and inevitably I say, so when are you open? And they're like, well, this has happened too many times to count. We're open Monday, Tuesday, Thursday, Friday from 9 to 4. So hours that are totally
at work.
And meanwhile, these days, I think still 75% of moms work.
Yeah.
So and it's 75% of all families have all the one or more of all of the custodial parents, whether it's one or more, are working. So how on earth can you expect a parent to drop everything to come in and do your well visits at an age when they don't understand the value?
Right. And
you're asking them to do something inconvenient. It's shocking that pediatricians get as many patients as they do. And so what we know, Brandon, you know this. I think we've actually even discussed it. The average well visit coverage for 6 to 12-year-olds among PCC clients is about 55%, I think, 60%, which means 40% of them aren't coming in, which is crazy.
Yeah.
And so, when you tell me, I hear you heard you say it earlier today, we're open on Saturdays, that's what it takes. If you're in the service business, you need to actually find out what your patients need. And
Right.
someday I would not be surprised to find out that pediatricians have evolved to do the majority of their appointments between 6 a.m. and 8 a.m. and from 4 p.m. to 8 p.m. and they do something else in the middle of the day.
Yeah.
And I know that I just made someone say I'm never listening to this podcast. Yeah, but
this guy, how dare he? Yeah.
Yeah, but why would we presume even for a second that the physician's time is more important? The patients who are paying you, even indirectly, are the ones who choose to see you. And if on one hand you're going to be on SOAPM saying, oh, it's unfair, the RBCs are eating our lunch, you need to think about serving a different lunch. That's just the way I see it.
And that serving a different lunch, I think that goes into one additional thing that I wanted to add is that, some other data that I pulled is that last year we had active patients, and this is just I just went 1 year back, so I didn't go that we had seen more than one. So I know it's not the true definition of active patient, but anyways, I just went a year back, and we saw 2,600 and something, 2,600, let's say, in 70 patients, of which the average of each patient was about between 4.5 and 5 visits during that year, which if you do the math, it's like over 10,000 encounters and stuff like that. So, but my point is that the 2,600, let's say, that's really, what is the, Chip, you know this, a physician generally can do, what is it, like 1,500, maybe 2,000 patients? I mean, that's about as much as they can handle, right?
Right. The number when I first started in this business was 2,000 to 2,500, but it's dropped to about 1,500 in part because people are doing more well visits and they're not seeing.
Yeah. So okay, let's say 1,500. And by the way, that number is all of our providers. Some of them are part time, so don't think of it because like people start getting bent out of shape. I don't want to focus on our number in particular. I'm just showing that my point is that there's not that many patients that you need. So when the patients start going elsewhere, those aren't your patients. My point is that those aren't your patients. You only need those 1,500 patients that, and ideally you want less, right? And then make instead of 4 visits, make them 5 and 6 visits a year or whatever. But that's the other thing that drives me not so much crazy. But my point is like all these people are going and they don't understand. I'm like, well, some are gonna, and that's my point. Some people will go to Walmart, always go to Walmart, and they will never step foot into a Nordstrom's, right? And Nordstrom is not worried about that. They're only worried about Nordstrom peoples, and they want to make sure that if you're a Nordstrom target audience, that's who they're worried about. That's the only person that they focus on and they want it in. Now, whether there's overlap, okay, some people, okay, fine, but they're only interested in the Nordstrom type people, and they want to get 100% of those people into the store. They don't care about every single one of Target's patients and sorry, not Target's patients, Target's customers, Walmart's customer, Kmart. I don't even know if they're still around. Everybody else. They're only worried about.
Yeah, and let me add to that, because one of the objections that you had on the SOAPM list, exemplified for me I would call it a fundamental. I don't want to say misunderstanding, because I know the physician in question who made this objection. I know he doesn't quite misunderstand, but there's a fatalism to the way that people feel about the RBCs. His point was this: how can you be the Nordstroms in your spectrum of places where patients can get their health care when you aren't in control of your own reimbursement, that you can't charge, all right? And his objection was, look, pediatrics remains a volume business, and he's got a point. You can't easily see just 3 patients a day at $1,000 each to get the equivalent of 100 patients a day for $30 each or whatever. However, the flaw in that reasoning, as far as I see it, is okay if you clearly feel that it is solely, because I don't think it is, but if it's solely a volume business, you're still obligated to do something about your patients. I'm supporting the point you were just making. You're not looking, you are not trying to get every patient to come see you, but you need to make sure that any patient who should have come to see you does and doesn't end up at the RBC. So sure, if we want to focus on just the volume nature of pediatrics, it's still a valid point that you have to distinguish what you do, otherwise you will lose valid appointments in your office. And that's the difference. That's where I sort of toss my hands up and say, okay, fine, we can't be Nordstrom's, maybe that analogy is imperfect, but it doesn't invalidate the fact that you need to attract the patients who are supposed to be coming to you, period.
Yeah, exactly. So, I mean, if you make a decision and that's the route you want to go down, that's fine, right? I mean, if you want to be a volume-based, like personally I don't, I'm looking for ways to not be a volume-based business. But if that's the way that you think and your strategy and what you think is the most viable, which is great, knock yourself out. But you need to, then there needs to be some efficiencies because you're going to be seeing like you said the 100 fevers and all this other stuff in order for you to just put those patients in as fast as you can and put them out. So it needs to be like a car wash or something. I mean something quick, but you'll have to adapt to the circumstances. Is kind of my point. So if you want to go the low route. I don't want to say the low route, but the efficient route, let's say, then you're going to have to make some changes regardless, and then still differentiate yourself from the rest. I mean, that's my point. You're still going to have to do the things that I'm going to do, except you're going to do it, highlighting what your strengths are as opposed to ours.
Yeah, and let's just add, you used the word I love to think about, and that's differentiation. To aim all of your fear at RBCs is a waste of time. For most people who are going to listen to this podcast, they also need to differentiate themselves from other pediatric practices. And they've totally forgotten about the fact that 10 or 15% or more of their patients drift to other practices. It's not just RBCs where you might lose them for a weekend. All right? It's this guy doesn't come to see me anymore. Why not? Well, if you're not distinguishing yourself from a better organized, better messaging practice like Brandon's, let's say, then your own friends are going to eat your lunch. And so I just see all these objections to, I don't, along the lines of, I don't want to change the way I'm doing things. I like things the way they are. I just want the results to be different. And that doesn't work. That doesn't work.
And I'll tell you, I mean, I'll be here very frank and very open. I mean, I seem to think that we do very well, but, that's kind of like asking a husband, "Are you a good husband?" You're not the right person to ask. You need to ask your wife about that. So,
she's not the right person to ask either.
The truth is that as hard as we try to make ourselves, like I put my money where my mouth is, and sometimes we're successful, sometimes we're not. So it's not like I have it all figured out. I mean, these are just trial and errors, and some things go well, some things don't. I just announced that we've never told anybody about our open access. That was kind of like, oops, we've been open for 10 years. So what I was going to say was that we have patients that go to other practices as well, and I'm like, oh, how can this be? It's like we're the most awesomest of what? So it is a reality. We get people, and I go to their website, the other doctor's website, and I'll, look through their stuff. Like, what do they have that we don't have? And like, they're not even open as much as we are. And, it's like we start trying to overanalyze everything. So even a practice like ours also suffers from. No, I don't want to make it seem better than anybody else, but what I'm highlighting is the reality of what you're saying.
Own it. Oh, you should say I mean, Brandon, how many pediatric practices will have someone on staff, technically, who would even spend a minute doing a pediatric practice management podcast? You're talking about 1% of 1%. So you are more awesome. You're consciously addressing the needs of your patients, and I think that puts you in a minority among pediatric practices. Believe me, I talk to them all day, every day.
Yeah.
So good for you. All right. Well, do we have anything else to add before we peel out of here?
Well, do you have might as well, since this is being sponsored by Salute Pediatrics and PCC, because they are giving us an hour and a half or so of their paid time, or it's on their dime essentially.
Right.
you got some speaking things. I don't do speaking. I don't know if you did. I tell you that I've stopped doing speaking engagements. So I don't have anything to plug anymore, other than my blog, perhaps. But I know that you have some speaking stuff. So do you have anything coming up that you want to share? Because people do ask me, like, hey, what's coming up, or what practice management seminar can I go to?
Well, you know what? I appreciate the fact that you asked, because I am very busy. I don't think my family's really registered how much I'm going to be gone the next couple weeks. So let me tell you, on April 25th, 26th, and 27th, Suzanne Madden and I will be at the California Chapter 1 AAP event in Lake Tahoe, California. And when I get back from that on May 1st, I'm going to be at the annual Ed Penn Lecture and CME program for the Massachusetts Academy in Waltham, Mass. The week after that, I'm going to be in Cincinnati or in Kentucky, right in there with RVPI. It's a large physicians group there. I'm going to be speaking there.
So and is it open to the? I mean, is this like private or open? I mean, can people sign up and to go to seminars if they're in their area or their block?
For the last one, if for some reason you are in that area and you have no idea what I'm talking about, email me and I will get you in. Absolutely, chip@pcc.com. Though everyone who lives in that area knows who I'm talking about.
Okay.
In August, at the end of August, I think Labor Day, I am going to be speaking at the Florida AAP meeting, and then in September 18th, 20th, 21st, I'm going to be speaking at the Texas Pediatric Society meeting. And then, of course, in July, I don't stop talking at the PCC Users Conference.
Okay, let me rephrase the question, because this isn't about you. So all I heard was, I was speaking here, I'm going to be speaking there. So let me rephrase the question. What management events will you be attending in the next few months where people can go to and hear other people besides you? Okay, was that clear enough?
No, it's because, you know what? If I'm gonna tell you that you need to differentiate yourself and make it known where you are available, the same is true on my side. And I'm only partially joking. If you're listening this far into this podcast, you like listening to at least one of us. And so if you want to hear more of it, but in person, and everyone who knows me knows that.
But we don't know which 50%.
Exactly. And you also know if I'm around, then all the meals and drinks are on me. So I'll do whatever it takes to get someone to go. If you're there, the fact of the matter is, the Florida AAP has a great event lined up. The California chapter is really, really cool. I can say the same thing about each one of them. I get to see all the agendas. I don't understand it when.
Why more people don't go?
Yeah, I do not get it. I don't get it. And so I don't even know if there's a fee for any of these events. And if there are, you know what? There might be a fee for the Florida chapter meeting, but it's at Disney, and they've got they're letting people stay at the Plantation site, the Florida, the high-end Disney resort, and it's only like $200 a night. So you're not going to get a better deal. Dr. Scheckman, who runs the show, has a really awesome agenda in the works. I mean that sincerely. It's pretty impressive. I'm actually going to say that in the next 2 or 3 years, I think the Florida AAP meeting is going to become one of the premier chapter meetings in the country, and they just won the SOAPM award to make that happen. So I'm pretty pumped. And you know what? If you skip my talks, everything else at each one of these events is worth going to.
Well, good. I'm glad you pointed that out, because before your previous monologue, it seemed like you were the only reason people had to go to. So I'm glad you pointed that out.
It's sufficient reason to go, but not the only reason to go. Yeah, Suzanne Madden is going to be in Tahoe. Wendy Sue Swanson is going to be giving I think her talk via Skype. There's a really cool PCMH talk happening in Massachusetts, and so on. So there's something everywhere. If you go to my blog, I've outlined them, and you can click on the event and see what else is happening there. So you can cross my name off and look at the other stuff. But I will say this: if you come to one of my lectures and it's not great, I will pay you $50. How's that sound? That's the truth.
Or are you just saying that and then you're just going to cut this out at the very end?
No, I won't. You'll know. If you come to one of my lectures especially one that you haven't been to before. You heard it.
Oh, see, now you're putting a little asterisk. You're putting a little asterisk on your condition.
If you, but I'm going to add to it. If
Are you going to have a guy like talk really fast? These all only apply, only valid in the U.S.
Not awesome, and this is not an or, this is an and. If it's not awesome, if you don't learn something that changes your practice, if you don't get your money's worth, and if you don't actually laugh, all right. If I can't make you laugh, you just let me know. Look me in the eye and just say, Chip, you know, it didn't work on me, and I'll send you a check for $50. How's that?
I'm going to extend that. I'm going to extend that. What do we call it? Offer or everything. That if they, for this podcast, if they have any of that thing that they didn't like it, they didn't laugh or anything like that, we're going to refund them their money.
There we go. Actually, you know what? I probably can't make that promise for any of the CME events. I could probably just lose, like, so for anyone from CME listening to this, I'm kidding. I mean, I'm not kidding. I will pay people $50 for the non-CME events. I'm not kidding about that. But I am not enticing people to a CME event given by a vendor with money.
Oh, Brad, you're going to have to edit this out. You just got yourself in so much trouble.
I think I just got kicked off of the NCE. I'm supposed to talk to the NCE. I might have to cut this. I won't. We'll see. You know what? No one from the AEPs.
This is dangerous. You're already treading dangerous water. We should have cut this off like 15 minutes ago, 10 minutes ago.
You know what? I've yet to have anyone say that they listened all the way or watched all the way to the end of the video. So we'll see. Someone write me and tell me. And I'll
the whole thing.
You listen to this whole thing. The first person to say, I listened to the end when you talked about the money, you let me know, and I'll send you like a Starbucks gift card for $50. How's that?
Right. Same all here. Right, well, let me know, and I'll refund you your money.
Yes, and it can't be a relative of Brandon. You know. All right. Thank you. I appreciate it. We'll talk to you soon.
All right. See ya.